Today, we're going to talk about a serious problem facing many communities across the United States. A new and very dangerous substance is appearing on the streets, and it is causing a lot of harm. You might have heard whispers about it on the news, or seen troubling pictures online. People are calling it the zombie drug because of the strange and frightening way it affects those who use it. This drug is creating what some are calling zombie towns, places where many people seem to be in a daze, barely moving and suffering from terrible health problems. It's a difficult topic, but it is one we must understand to protect our families and our neighborhoods. This isn't a story from a horror movie. It is a real-life public health crisis that is unfolding right now, on this day, June 12, 2025. The drug is changing the landscape of addiction and creating new challenges for doctors, police officers, and families. It is a silent invader that mixes with other illegal drugs, making them much more deadly. The people who take it often don't even know they are consuming this dangerous substance until it is too late. Our journey today will be to shine a light on this dark corner, to understand what this drug is, how it works, and why it has earned such a terrifying name. The term zombie town may sound dramatic, but for the residents of the areas most affected, it feels very real. Imagine walking down a street in your city and seeing groups of people frozen in place, bent over in strange positions, seemingly unconscious but still standing. This is the scene in parts of cities like Philadelphia and Los Angeles, where this new drug has taken a strong hold. It is a heartbreaking sight that leaves communities feeling scared and helpless. The people suffering are not monsters. They are our neighbors, our friends, and our family members who have been caught in the grip of a powerful and destructive addiction. Our goal in this discussion is not to scare you, but to inform you. Knowledge is our most powerful tool against a crisis like this one. By understanding the true nature of this drug, we can learn how to talk about it, how to spot the signs of its use, and how to support the efforts to fight it. We will explore the science behind the substance, hear stories from the front lines of this battle, and look at what is being done to bring hope back to these struggling communities. Together, we can face this challenge with clarity and compassion, working towards a safer and healthier future for everyone. So what exactly is this substance that has caused so much alarm? The drug at the center of this crisis is called Xylazine. This name might be new to many of you, and for a good reason. Xylazine is not a drug made for humans. It is a powerful tranquilizer, a type of medicine used by veterinarians to sedate large animals like horses and cattle for surgery or medical procedures. It is a strong muscle relaxant and pain reliever that is approved only for animal use by the Food and Drug Administration or FDA. It was never meant to be consumed by people, and that is a major reason why it is so incredibly dangerous. The street name for xylazine is Tranq or Tranq dope. It is rarely sold or used by itself. Instead, drug dealers are mixing it with other illegal drugs, most commonly the powerful opioid fentanyl. They do this for a couple of reasons. First, xylazine is cheap and easy to get, so it allows dealers to increase the weight and volume of their products, making more money. Second, it changes the effect of the fentanyl. Users report that adding xylazine makes the high from fentanyl last longer. This extended effect is what many people struggling with addiction are seeking, but it comes at a terrible hidden cost to their health and safety. The reason it is called the most dangerous drug by some experts is because it combines the worst aspects of different substances. Fentanyl is already incredibly deadly. It is an opioid that can stop a person's breathing in minutes. When you add xylazine, which is a powerful sedative but not an opioid, you create a deadly cocktail. A person who has overdosed on this mixture is much harder to save. The usual life-saving medication for an opioid overdose, naloxone, often known by the brand name Narcan, does not work on xylazine. Naloxone can reverse the effects of fentanyl, but it does nothing to reverse the effects of the tranquilizer. This creates a nightmare scenario for paramedics and emergency room doctors. They can give someone naloxone to restart their breathing from the fentanyl, but the person may remain unconscious and their blood pressure can drop to dangerously low levels because of the xylazine. This makes every overdose case much more complicated and life-threatening. The body is being attacked on two different fronts by two different types of drugs. This deadly combination is why xylazine has been officially declared an emerging threat by the White House, signaling a nationwide alert about its devastating impact. Now let's look closer at what happens to a person who uses xylazine. The effects are what give the drug its terrifying nickname. When someone takes a drug mixed with xylazine, their body experiences a profound shutdown. As a powerful sedative, it causes extreme drowsiness and a state of amnesia, where the person has no memory of what happened for hours. This isn't like falling asleep, it's a deep, stupor-like state. People can stand, sit, or lie in one position for a very long time, completely unaware of their surroundings. Their bodies become rigid, and they often bend over at the waist, a posture that has become a hallmark of Xylazine use. This trance-like state is what leads to the zombie comparison. From an outsider's perspective, a person under the influence of Xylazine can look like they are frozen in time. They might be standing on a sidewalk completely unresponsive, with their head down and arms hanging limply. This is incredibly dangerous. A person in this state is vulnerable to robbery, assault, or accidents. They could fall into traffic or collapse in a dangerous location without ever realizing it. The drug essentially disconnects the mind from the body, leaving the person helpless and exposed to the world around them. Beyond the immediate sedative effects, Xylazine causes a person's breathing and heart rate to slow down dramatically. This is called respiratory depression, and it is the main reason people die from an overdose. When Xylazine is mixed with fentanyl, which also causes respiratory depression, the risk of death multiplies. The body's vital functions are pushed to their absolute limit. The person's blood pressure can plummet, and their body temperature can drop. This combination can quickly lead to a fatal overdose that, as we discussed, is very difficult to reverse completely with the tools first responders typically use. Another frightening effect is the way it impacts a person's physical body over time. Long-term use of Xylazine leads to severe and painful skin wounds. These are not just simple sores. They are deep, dead tissue wounds known as necrotic skin ulcers. They can appear all over the body, not just at the injection site. These wounds are extremely painful, get infected easily, and can look like a severe burn. If left untreated, the infection can spread into the bone or bloodstream, leading to amputation of limbs or even death. This physical decay adds another layer to the zombie label as individuals suffer from disfiguring and life-altering injuries. To truly understand the impact of Xylazine, we need to look at a community that has been hit the hardest. The Kensington neighborhood of Philadelphia, Pennsylvania, is often called the ground zero for the Tranq crisis in America. For years, Kensington has struggled with high rates of poverty and drug addiction, particularly with heroin and then fentanyl. But when Xylazine arrived, it turned a difficult situation into a public health catastrophe. The streets of Kensington are now filled with scenes that are hard to comprehend. It has become a real-life example of a so-called zombie town. Walk through certain parts of this neighborhood, and you will see the drug's effects firsthand. People are gathered on sidewalks, in parks, and in abandoned lots, many of them locked in the characteristic Xylazine stupor. They stand bent over or sit slumped on the curb, motionless for hours. The sense of hopelessness is overwhelming. Community outreach workers and medical teams patrol these streets every day, trying to help, but the scale of the problem is immense. They offer wound care, food, water, and a path to treatment, but many are so deep in their addiction that they are not ready or able to accept the help being offered. The local healthcare system in Kensington is stretched to its breaking point. Hospitals are seeing a huge increase in patients with the severe skin wounds caused by Xylazine. These wounds require specialized, long-term care, including surgery and powerful antibiotics. Dr. Joseph D'Orazio, an emergency physician in Philadelphia, has described the wounds as some of the worst he has ever seen in his career. The medical staff must not only treat these terrible physical injuries, but also manage the patient's complex addiction and withdrawal symptoms, which are more severe and painful when Xylazine is involved. The crisis has also changed the very fabric of the community. Residents who have lived in Kensington for generations feel like they are living in a war zone. They are afraid to let their children play outside. Businesses are struggling to stay open. The constant presence of open drug use and human suffering has taken a heavy toll on the mental health of everyone in the neighborhood. Community groups and local leaders are desperately calling for more resources and a coordinated government response to help them reclaim their streets and save the lives being lost every single day. Kensington's story is a stark warning to the rest of the country about how quickly Xylazine can devastate a community. Understanding how a drug like Xylazine spreads is, honestly, key to stopping it. Its journey into the street drug supply is really a story of economics and deception. As we mentioned, Xylazine is an inexpensive veterinary tranquilizer. For drug trafficking organizations, it's a perfect cutting agent or filler. By mixing a small amount of powerful fentanyl with a larger amount of cheap Xylazine powder, they can produce so many more doses to sell from the same batch. This increases their profits significantly. The deception comes from the fact that, well, they rarely tell their customers that this new ingredient has been added to the supply. People who have been using fentanyl for a long time develop a tolerance to it. This means they need more of the drug to get the same effect. When they are sold a mixture of fentanyl and xylazine, they notice that the high lasts longer. This extended effect can be very appealing to someone trapped in the cycle of addiction, as it delays the painful symptoms of withdrawal. They might specifically look for this Tranq dope, not fully understanding the new and severe risks they are taking. The drug's reputation spreads by word of mouth on the street, creating a demand that dealers are frankly more than happy to supply. The spread of xylazine followed the same pathways that fentanyl used to infiltrate the country's drug market. It started appearing on the East Coast, particularly in cities like Philadelphia and Baltimore before moving west. Law enforcement data shows a frightening increase in the number of drug seizures that test positive for xylazine. In just a few years, it went from being a rare substance to a common adulterant found in a majority of fentanyl samples in some cities. This rapid spread shows how quickly and efficiently drug networks can adapt and introduce new substances into the illegal market, staying one step ahead of public health officials. This creates a dangerous environment of unpredictability for anyone using illicit drugs. A person might think they are buying fentanyl, but they are actually getting a cocktail of unknown strength and composition. One batch might contain a little xylazine, while the next could have a lethal amount. There is no quality control in the illegal drug market. This is why public health experts are so concerned. It's not just one drug we are fighting, but a constantly changing and increasingly toxic mixture of substances, with xylazine being the latest and honestly, one of the most frightening additions to this deadly problem. One of the most visually shocking and medically challenging aspects of the xylazine crisis is the development of horrific skin wounds. These are not the typical infections that can occur from injecting drugs. Xylazine causes something much worse. It appears to restrict blood flow in the body's smallest vessels, the capillaries. This means that oxygen and nutrients cannot reach the skin and underlying tissue. As a result, the tissue begins to die. This process is called necrosis, and it creates large open sores that are covered in a thick black leathery crust of dead tissue called eschar. These wounds, or necrotic ulcers, are profoundly painful and can appear anywhere on the body, not just where the drug was injected. People who smoke or snort xylazine-laced drugs have also developed these sores. They often start as a small blister or a tender spot and quickly grow into a deep crater-like wound that can expose the muscle or even the bone underneath. The wounds are also very prone to serious infections from bacteria. The dead tissue provides a perfect environment for bacteria to grow, leading to dangerous infections like cellulitis or osteomyelitis, which is an infection of the bone. Treating these wounds is a long and difficult process. Simply putting a bandage on them is not enough. The dead tissue must be surgically removed in a procedure called debridement. This is often very painful and may need to be repeated several times as more tissue dies. Patients require intensive wound care, often involving special dressings and powerful antibiotics given through an IV to fight the infections. For many people who are homeless or still actively using drugs, getting this kind of consistent medical care is almost impossible. They might get their wound cleaned at a clinic one day but then be back on the street, unable to keep it clean or change the dressing. The consequences of untreated wounds are severe. Widespread infection can lead to sepsis, a life-threatening condition where the body's response to infection damages its own tissues and organs. In many cases, the tissue damage is so extensive that the only way to save a person's life is to amputate the affected limb, a leg, an arm, a hand, or a foot. Hospitals in cities with a major xylazine problem have reported a sharp increase in the number of amputations they perform on young people. This is a devastating, life-changing outcome for someone already struggling with the immense burden of addiction. The rise of xylazine has created a whole new set of challenges for the brave first responders and healthcare workers on the front lines of the overdose crisis. For years, paramedics and police officers have been trained to respond to an opioid overdose with one primary tool, naloxone. This medication is a miracle drug that can block the effects of opioids like heroin and fentanyl on the brain, allowing a person who has stopped breathing to be revived. But xylazine is not an opioid, so naloxone has no effect on it. This simple fact has completely changed how emergency teams must approach an overdose. When a first responder arrives at the scene of an overdose today, they can no longer assume it is only from opioids. If the person is unconscious and not breathing, they will still administer naloxone, because fentanyl is almost always part of the mix. The naloxone might restore the person's breathing, but they may not wake up. They remain in a deep, sedated state because of the xylazine. Their blood pressure and heart rate can still be dangerously low. Paramedics must then provide supportive care, like giving oxygen or using a bag valve mask to help them breathe, and rush them to the hospital for more advanced medical treatment. In the hospital emergency room, the challenge continues. Doctors and nurses face a patient with a complex and dangerous mix of symptoms. They have to manage both the opioid effects and the sedative effects. There is currently no specific reversal agent or antidote for a xylazine overdose in humans. Treatment focuses on supporting the body's vital functions, managing the airway, providing oxygen, and using medications to raise the heart rate and blood pressure until the drug wears off. This requires intensive monitoring and resources, putting more strain on already busy emergency departments. Furthermore, the withdrawal from xylazine is reported to be extremely severe. When a person who regularly uses Tranq stops, they experience not only the terrible symptoms of opioid withdrawal but also intense anxiety, agitation, and high blood pressure from the xylazine withdrawal. Medical professionals are still learning the best way to manage this dual withdrawal. It often requires a combination of different medications and a longer, more complicated detoxification process. This makes it even harder for individuals to take the first step towards recovery, as the fear of this painful withdrawal can keep them trapped in the cycle of use. In the face of such a devastating crisis, communities are not standing by silently. They are fighting back with courage, innovation, and compassion. The response is coming from all levels, from grassroots community organizations to federal government agencies. One of the most important strategies is harm reduction. This approach aims to keep people who use drugs alive and as safe as possible, even if they are not ready to stop using. Harm reduction groups are on the streets every day, building trust and providing critical supplies and information. These outreach teams, often made up of volunteers and people with personal experience of addiction, distribute kits that contain more than just clean syringes. They now include supplies specifically for wound care, antiseptic wipes, sterile bandages, and antibiotic ointment. They teach people how to recognize the signs of an infected xylazine wound and urge them to seek medical attention early. They also distribute fentanyl test strips, and now, newer xylazine test strips. These strips allow a person to test their drugs for the presence of these dangerous substances before they use them, giving them information that could save their life. Hospitals and clinics are also adapting their methods. They are creating specialized wound care programs designed to meet the unique needs of this population. Some clinics offer walk-in services, so people do not need an appointment to have their wounds cleaned and dressed. They understand that people who are homeless or in active addiction have chaotic lives, so they make it as easy as possible to access care. These healthcare providers treat their patients with dignity and respect, which is essential for building the trust needed to guide someone toward long-term treatment and recovery. At the national level, the government is beginning to take action. The White House's designation of fentanyl mixed with xylazine as an emerging threat was an important step. This action unlocks federal funding and resources to develop a coordinated national response plan. This plan includes improving data collection to track the spread of the drug, expanding access to testing and treatment, and disrupting the illegal supply chain. It is a massive undertaking that requires collaboration between law enforcement, public health officials, and community partners. The fight is difficult, but these combined efforts are a sign that help is on the way. The story of xylazine and the zombie towns it creates is a frightening chapter in our nation's ongoing struggle with addiction. We have seen how a veterinary tranquilizer has infiltrated the illegal drug supply, creating a deadly cocktail that is more dangerous than anything we have faced before. We have learned about its devastating effects, the deep stupor that leaves people vulnerable, the complicated overdoses that challenge first responders, and the horrific wounds that can lead to amputation. The images from neighborhoods like Kensington are a powerful and heartbreaking reminder of the human cost of this crisis. This is not just a problem for big cities or for a small group of people. As we have seen with past drug epidemics, what starts in one place can quickly spread across the country. That is why awareness is our first and most important line of defense. We all need to understand what Xylazine is, what it looks like, and the unique dangers it presents. By talking about this openly and without judgment, we can reduce the stigma that prevents people from seeking help. The people suffering from this addiction are not zombies. They are human beings in desperate need of medical care and compassion. The path forward requires a united effort. We must support the harm reduction groups who are doing life-saving work on the ground every day. We must give our hospitals and healthcare workers the resources they need to treat the complex medical issues caused by Xylazine. We must encourage our leaders to continue developing and funding a smart, comprehensive plan that addresses both the supply of the drug and the root causes of addiction, such as poverty, trauma, and lack of opportunity. This is a public health crisis, and it requires a public health solution, not a purely law enforcement one. There is reason for hope. Every day, dedicated people are working to turn the tide. Every time an outreach worker cleans a wound or a doctor successfully manages a complex withdrawal, a life is being valued. Every person who finds their way into recovery is a victory against this terrible drug. The challenge is great, but the strength and resilience of our communities are greater. By facing this threat with knowledge, empathy, and a commitment to action, we can heal our zombie towns and build a future where no one is left behind in the shadows.